That's good. There we go.
Okay. Can you hear me okay?
I can hear you great.
Okay, perfect. Thank you for making time for me. I really appreciate it.
No problem.
Okay, so today I'm just working on a little story, hashing out the vaccine, how safe it is, and what's actually in it. Um, so first, can we just start on the difference between the COVID vaccine and the flu vaccine? Where
Right.
the flu vaccine has the flu in it, whereas the COVID vaccine
Right.
does not have COVID in it.
So there are a number of COVID vaccines that we're talking about, but really the important ones for today's conversation are the Pfizer and Moderna jabs. And these are a new technology, an mRNA technology. Now, we have seen this before, like there have been trials on rabies, for example, but this is the first time we have an mRNA vaccine about to be used on tens of thousands, if not millions of people. The difference is in how the piece of the virus shows up in your cell. All vaccines work the same way. They work the same way by essentially exposing your body to something resembling the virus to give it target practice. In the olden days, that was an actual virus. Then we weakened the virus. Then we killed the virus. Then we showed a portion of the virus, like the license plate of a car. So some of the vaccine candidates are just that, a license plate. And the license plate here is the spike protein. This is a protein on the surface of the SARS-CoV-2 virus. So this is important because the actual virus itself is not entering the cell, just the license plate. And your body sees the license plate and says, oh my God, it's a spike protein, must be a virus, will create antibodies and attack it. So some of the other formulations like the Russian Sputnik V, the Oxford AstraZeneca, the CanSino Chinese vaccine, all deliver that spike protein as a Trojan horse embedded in another harmless virus called an adenovirus. And the Oxford one uses a chimp adenovirus. So it's essentially a torpedo or Trojan horse that sneaks into your cell and says, hey, look, a spike protein from SARS-CoV-2. And your body goes, oh my God, a spike protein, and attacks it. With the new mRNA virus vaccines, it's really quite clever. Instead of an actual license plate or spike protein, it's a recipe card, the mRNA recipe card, that it shows up surreptitiously, inserts it into one of your protein-making machines in your cell, and your body makes the license plate. And it says, oh my God, a spike protein, where did this come from? And attacks it. So it's just another way of getting the spike protein into your cell. That's all it is. And it's really exciting because we can do it quickly. In fact, they had the vaccine made, I think, within 48 hours after getting the genetic code of the virus. All this time was simply testing to see if it worked. So this means in the future, we can probably make all kinds of vaccines using the same technology against a variety of different kinds of pathogens, so long as we have their genetic code. So that's the key difference here. It's showing the instructions of how to make the license plate, not actually delivering a virus or a piece of the virus to yourself, as with the flu vaccine.
Why do you think the mRNA technology is being used rather than what's used to make the flu vaccine?
Well, what's used to make the flu vaccine is sort of being used in other formulations. It's just that the mRNA ones seem to work really well and got to market faster with better data. And that's not surprising because, as I mentioned, it's really fast to make mRNA vaccines, as it turns out, so we can start testing them faster and earlier. So it's a powerful new platform that, in my opinion, might revolutionize how we treat infectious diseases in the future.
Okay. And in terms of safety, the FDA released their 53-page report today backing Pfizer, saying it is safe. It can fight against COVID-19. So for people kind of nervous about this vaccine, it is getting that support from the FDA. We still need Health Canada approval, but how confident should people feel in this?
They should feel as confident in this as they would in any product that's been backed by the FDA or eventually Health Canada. The same rigorous precautionary procedures are put into place. So no corners have been cut here. So if any logic that Health Canada has approved, like the shingles vaccine or the measles vaccine, is good enough for you, then this should be as well. So the safety is pretty impressive. A very small percentage of people have adverse reactions, and the most common adverse reactions are pain at the site of the injection, some fatigue, some fever, and that seems to last a day or two. And that's not uncommon for a lot of vaccines. I had my shingles vaccine 2 years ago, and I had 48 hours of just crippling fatigue, but it went away, and now I'm immune to shingles. So that's the good trade-off. People have to remember that even though these are rare adverse events, I mean, really rare, like less than 10% of people will have these experiences, if not less than 5%, incorrect. When this is scaled up to hundreds of millions of people getting vaccinated, that's a large number of people who are going to report these events, and that might spook people when they hear about it. But your probability of having an adverse event is quite low. Whereas the probability of having a bad experience to COVID might be a little more dire, depending upon who you are. So we have to balance the risk versus benefits here.
Mm-hmm. And the importance of having the double dose vaccines. Can you kind of speak to how effective it is to have that second dose and potentially how long the antibodies could stay in our body?
Right. So according to the trial data, we get maximal protection after 2 doses. So you essentially stimulate your body twice and suddenly, I get it now. I have to make all these hold them here for a while. It looks like immunity is maintained for at least 3 or 4 months, probably longer. Now, we don't know if it's longer because, frankly, no one's been tested longer than 3 or 4 months. But it seems reasonable given the size of the antibody reaction that it will be significantly longer, probably more than a year, if I had to guess, maybe even 2 or 3 years. So it's unlikely that we'll have to do this every year, but you never know. Having said that, there are some unknowns here, obviously, and we do the best we can given the risk and benefit ratio. We do the same thing when we cross the street or get in our car or have a drink of alcohol or do anything else in our life. So everyone needs to keep that in mind and recognize that even though it's scary to be injecting a new thing into our body that seems to be rushed into production, again, no corners have been cut, and the safety profile really is extraordinary compared to some other products that we might be facing.
Mm-hmm. And you touched on some of the potential side effects, and in this FDA analysis talks about having that this scar where you get where it gets administered, as well as fatigue and potential headaches. And so a lot of the trial participants had those side effects, but they are, I guess, minor compared to getting COVID. But you kind of touched on people could get spooked out if they see a large portion of the population get some of these side effects. But so yeah, we're kind of balancing this report, talking about the side effects, but also not trying to alarm people by them.
That's right, but we have to be transparent here. When this is given to hundreds of millions of people, some people are going to get seriously sick from this. That's kind of unavoidable. And the data does suggest that a tiny, tiny minority of people experience some more severe side effects that may not even be associated with the vaccine. The FDA actually concluded that these serious adverse events were not caused by the vaccine, but you never really know. So, in the interest of transparency, we have to recognize that not everything is 100% safe, but I feel it's pretty extraordinarily safe, all things considered.
Okay. Anything else you'd like to add?
Yeah. So some people are concerned about the speed at which this is made and deployed, as if we're cutting corners. No. The reason that this was able to get to market, as it were, so quickly, a number of factors. Number one is that scientists pivoted from making vaccines from other things like Ebola to focusing on COVID, and that, as a result, a lot of the work was already done. Number two is we already had a lot of data from trying to make vaccines for SARS and MERS, so a lot of that stuff was done. Number three, government underwrit a lot of the risk for drug companies. So the biggest barrier to getting vaccines to market isn't the science, it's the money. Now money wasn't a factor, so that took away a lot of the barriers. Then we had the fact that a lot of the administrative barriers were removed, like you didn't schedule meetings, you just had them. You don't wait for all the data to arrive, you assess the data in real time. You don't wait until phase 2 data is complete before you start phase 3. You don't wait until everything's done before you start manufacturing. Manufacturing is done right away. Then we had enormous numbers of people recruited for the phase 3 trial, tens of thousands of people, which is a huge number for a phase 3 trial. And that speaks to the money again. As a result, we got numbers, we got outcome result numbers much faster than we would have otherwise. And that's the result of people volunteering to put their bodies at risk. So for all the reasons I mentioned, this hasn't been rushed. It's just been expedited because people focused on it. This is the result of an extraordinary amount of administrative focus and resources and care, not the result of anyone being shoddy with any sort of safety precautions.
Well said. I know that's a question a lot of people have, or a reservation a lot of people have,
Right.
the speediness of it all. Thank you so much. I'll just end with your first and last name.
I'm Raywat Deonandan, epidemiologist and associate professor, University of Ottawa.
Perfect. Thank you so much. I appreciate it.
No problem. Bye-bye.
Bye.